Yes, and timer is on, and here is your question.
Yes, ma'am. I'm ready, ma'am.
Yes, but we would have to wait for 1 minute. And in exam also, you'll be given 1 minute to read the stem.
Yes, ma'am.
Right. So if you have read and understood, considering its surgical pathology station, please tell me what you understand by the term signet cell carcinoma.
Signet cell carcinoma is an aggressive form of gastric malignancy, and it is um, it is it is a rare form of adenocarcinoma. It secretes mucin, and histologically, it has a shape of signet ring shape.
Shape of a ring. Yes.
Yes, ma'am.
Can you tell me the pathogenesis behind gastric carcinoma?
Yes, ma'am. So initially, the gastric mucosa is normal, and frequent irritation it undergoes for chronic gastritis.
Yes.
So this chronic gastritis gives way for intestinal metaplasia.
Yes.
The metaplasia becomes dysplasia,
Yes.
and then it harbors carcinoma in situ, that is in the mucus,
Yes.
and it becomes an invasive carcinoma, ma'am.
Okay, good. Very good. Okay, can you name few risk factors which contribute towards the formation of gastric carcinoma?
Yes, ma'am. So I would consider the most important risk factor is H. pylori infection, followed by diet containing nitrosamine, that is smoked food and smoked fish, salmon
Yes.
fish,
Yes.
followed by menetrius disease, and followed by intestinal metaplasia, polyps, adenomatous polyps more than size more than 2 centimeter.
Yes.
And smoking, alcohol, HNPCC, FAPs are
And
all
male gender.
risk
And
factors.
male
Yes,
gender.
and pernicious anemia. Yes, ma'am.
Yes. And blood group A, diabetes
A blood
mellitus.
group. Yes, ma'am.
Yes. So
Yes,
these
ma'am.
are all the risk
Common
factors.
risk factors. Yes, ma'am.
Do you think there are any genes involved in the formation of gastric carcinoma?
Yes, ma'am. APC,
And
P53 tumor suppressor gene, ma'am.
all right, okay. Can you tell me how would you classify gastric carcinoma?
There are a lot of classifications, ma'am.
Very
There are
good.
Lawrence
Yes.
classification, Bowman's
Yes.
classification, and WHO's classification, ma'am.
Yes. And
Lawrence classification.
and there is another one basis on the direct spread. So there is early or advanced. Okay, please tell.
Okay, ma'am.
No,
Early
please
or
tell.
advanced, yes, ma'am.
Okay, please tell the Borman's classification of gastric carcinoma.
Bowman classification, it could be polypoidal, fungating, ulcerative, or infiltrating type, ma'am. Infiltrating is Linitis plastica, leather bottle stomach.
Okay, can you please tell me what are the commonest histological type of gastric carcinoma?
Adenocarcinoma, 95% it is adenocarcinoma, ma'am.
And this can also be divided into how many types?
Adenocarcinoma can be divided into intestinal type and diffuse type.
Very good. Okay, can you tell me any other types which has been identified?
Yes, ma'am. It could be lymphoma,
Yes.
which is and carcinoid type, maltoma, and
Squamous cell carcinoma.
squamous cell carcinoma. Yes, ma'am.
All right, okay. Can you please tell me which paraneoplastic condition is associated with gastric carcinoma?
Acanthosis nigrans and dermatomyositis, ma'am.
How could this be investigated or confirmed? Or what investigations would you ask for?
For paraneoplastic syndrome, ma'am.
Yes, please.
I could do a skin biopsy, ma'am.
And For
And
the yes.
but clinically, I will check for the insulin level, ma'am.
Okay, right. And for the investigation or confirmation of gastric carcinoma, how would you confirm your diagnosis?
I would go for an upper gastrointestinal scopy and
Yes.
multiple biopsies, ma'am.
Yes. And CT.
And yes, ma'am. And I'll go for metastatic workup. I'll do an CT chest and CT pelvic, ma'am. Pelvis, ma'am.
Good. And there could also be contrast barium swallow.
Yes,
Right.
ma'am.
Okay. And what are the procedure which is specific to the complication of? All right. How would you manage first? What
The
is the
patient has been
treatment?
already
Yes.
operated, ma'am.
Yes.
So I would choose my treatment depending upon the histopathology report, whether the
All right.
margins are
Tell
positive or
me
negative.
management for this particular patient, this case.
Yes, ma'am. So this case, since the patient is having, since it is a high-grade tumor,
Yes.
and a patient has undergone splenectomy, so I'd go
Yes.
for prophylactic vaccination for splenectomy, that is meningococcus, pneumococcus, and Haemophilus influenza
Yes.
vaccination. And then for signet cell carcinoma, I'll mostly it will end up in palliative therapy. So I'll go for a multidisciplinary approach. I will consult with the oncologist and then with the gastroenterologist. Provided I will go for the chemotherapy, ma'am.
Very good. Excellent. Can you please tell me what are the specific complications which are associated with total gastrectomy?
Dumping syndrome, ma'am.
Yes. So please classify them according to early and late. And please tell
Yes,
me.
ma'am. Yes, ma'am. A dumping syndrome, early dumping syndrome, and late dumping syndrome.
Yes.
Early dumping syndrome, it happens within 30 to 60 minutes after the consumption of meal.
Yes.
So what happens is when concentrated chyme is entering into the small bowel, there will be a vascular shift from the blood vessel. So what happens is the patient will experience abdominal pain, abdominal bloating, nausea, vomiting, followed by cardiac symptoms like tachycardia. Patient will have lightheadedness and fainting. This is for early dumping, ma'am. Late dumping syndrome, it happens because of high amount of insulin release because of rapid food in the intestine. So when there is a high amount of insulin, a patient will end up in hypoglycemic symptoms, which is weakness, confusion, and sweating.
Very good. Okay, which vitamin deficiency is associated with late dumping syndrome?
Vitamin B12, ma'am.
Because of?
Because of we have removed the part of stomach and the fundus and body of the stomach. So eventually we will be losing parietal cells. So we will be losing intrinsic factor.
Yes.
Yes, ma'am.
All right. Okay. If you would have to explain, this pathology report that you're looking at, how would you say it in 4 sentences?
It is stained with hematoxin and eosin staining, ma'am. I would see it as a signet ring shaped with vacuoles and a rim of cytoplasm seen, ma'am. I can see the nucleus as well.
Yes. So that signifies, yes.
Signet ring carcinoma, ma'am.
All right. Okay. Can you please tell me? All right. What I wanted you to tell me, just think acute complication of any surgery. What could that be?
Acute complication of any surgery, it could be anastomotic leak.
Yes.
It could be hemorrhage. It could be infection. It could be wound dehiscence. It could be acutasis, ma'am.
Yes, hemorrhage, infection, and
anastomotic leak.
this carcinoma, gastric carcinoma, leads to pancreatitis and
the cholecystitis. Yes, ma'am. Yes, ma'am.
That's what I was after. Right. Okay. Thank you. Right. Thank you.
Thank you, ma'am.
Excellent. Thank you.
Thank you, ma'am.